My first guest is Dr. Wallace Huff, who is an orthopedic surgeon with Bluegrass Orthopaedics. Welcome.
Thank you.
Well, now you do a little to everything. You do all kinds of bone, joint work, you do joint replacement, and you do sports medicine. Let's talk a little bit about surgical options for joint replacement, because there's some new things out, and actually you're even, I hear, doing it as outpatients.
Yeah, it's amazing, Jeff. An operation that's done probably 700,000 times a year in the U.S., and used to be an operation where people stay in the hospital sometimes up to 5 to 7 days 10 years ago. We're now doing as an outpatient procedure, going home the same day, and recovering much quicker due to some great technology that's come out over the last several years, which really increases the precision of the operation and helps decrease the downtime for the patient because of less trauma to the tissues and because of the accuracy of the operation.
Now you mentioned new technologies. There's a robot joint replacement and there's custom joint replacement.
Yeah, both are available, and we're utilizing both in our practice because of the increased precision that you get, just a reproducible technology that makes it a lot more accurate operation. Because really, when it comes down to it, we want to relieve the patient of their pain, but we want the implants, we want these operations to last a lifetime if we can. And I think for most of these operations, we can get up to 25, 30 years durability on replacements.
And that's hip and knee?
Hip and knee.
And you can do those custom and with robots.
Exactly, yeah.
And as an outpatient, but you think about it, boy, doesn't that hurt? I mean, how do they control pain from an outpatient?
So it is still a painful operation. So some of the things we've done to make this doable on the outpatient level, a couple things. One is getting the patient a plan before they get to the day of the operation. They need to have help lined up, family support, making sure we talk through all that before they get to the day of the operation, so they have a plan. Prehab is a big deal, I think, for making sure the patient's ready to have a good recovery. So we like them to get a little bit stronger and do a little bit of therapy before they get to the OR. Sometimes just self-directed exercise is helpful for that. And then multimodal pain management, which means, number one, we want the patients to have as little pain as possible. Number one, so they can get through this with a good experience, but also start their exercise day one, because nothing worse than having a stiff joint because the patient's not able to do their exercise. And to be able to go home the same day, you can't be loading people up with a lot of medicine that's going to make them drowsy and then send them home. So number one that's changed that is a good peripheral nerve block. So we utilize nerve blocks a lot. We use local anesthetic during the operation. We make sure the patient's well hydrated coming in, which tends to make them feel better after surgery. And that plus loading them with Tylenol before the procedure, the day before the procedure, making sure they're hydrated, doing the nerve block, and then other medicines in rotation, trying to stay away from narcotics. But this is a painful operation. We want them to stay ahead of the pain. Once the pain gets there, it's hard to get rid of. It's like a unwanted guest in your house. So it's better to stay ahead of the pain. But most of the time that could be done without a lot of narcotic medicine. We've also employed some therapeutic laser treatments within that first 1 to 2 weeks after surgery, and it really brings the swelling down. It's an FDA-approved treatment for pain and swelling after an operation that is FDA approved and endorsed by the CDC. So things like that to help avoid the exposure to opioids and narcotics.
Now you mentioned laser treatment. Real quickly, do you also use that in sports medicine for healing, joint healing?
Yeah, it's been a really revolutionary thing that's come out over the last 2 to 3 years. And it will eventually be covered by insurance. It's not covered yet. So it's a relatively inexpensive cash pay by the patient, but patients are benefiting so much from it, they're more than willing to pay a little bit of money at $40 a treatment for a series of 6 to 10 of those treatments. Really speeds up recovery, increases blood flow just by light energy being placed into the area of the surgery. And this can be done for people who are not having surgery, sports injuries. It enhances lymphatic drainage. It increases blood flow by increasing the ATP production and upregulating the mitochondria in the cells in that area. So it really creates a supercell as that ATP gets going due to the light energy that it's exposed to, and really brings healing cells into the area. It's really fascinating.
It's great information. We appreciate you coming in. Thanks so much. So if you've got joint pain, joint problems, or sports injury, Bluegrass Orthopaedics can help. We'll be right back.